Hello and welcome to this Clinical Care Options podcast. I'm Nicola Hansen, Scientific Director, here with Dr. Anton Porsteinsson, Director of the Alzheimer's Disease Care, Research, and Education Program, and William B. and Sheila Konar, Professor of Psychiatry, Neurology, Neuroscience, and Medicine at the University of Rochester, and Robin Martinez, a patient advocate who manages the online communities and patient engagement at Smart Patients, Inc. This episode of Cognitive Conversations will discuss HCP patient communication regarding brain health and cognitive decline, with a focus on psychiatric clinical settings. This podcast is part of our 2025 Brain Health Program, in partnership with Practicing Clinicians Exchange, Smart Patients, and the Society for Post-Acute and Long-Term Care Medicine, and supported by an educational grant from Lilly. Please visit the show notes for a link to our Brain Health Resource Hub containing many additional activities. Now let's get started and hear what our expert has to say.
Hi, Anton. It's nice to meet you today. Thank you so much for being here with us to talk to us about brain health, mild cognitive impairment, and all the extensions of that as we go through time. I know that you're in the thick of things with dementia, but we're dealing with a lot of people who have questions like, is this normal? How much memory loss is normal due to age? How much is due to hormones? How much is due to stress? Am I doing things wrong? Are there things I could be doing better about my health to maintain my brain health? So I guess our first question is, how comfortable do you think that community psychiatrists are when somebody comes to them with maybe a general list of problems? Maybe they're depressed, or maybe they're just concerned about their brain health and their ability to remember things. How do most community psychiatrists respond to these issues?
So, Robin, first of all, thanks for having me. And second of all, I think this is a very timely topic. There's a tremendous amount of interest among the population at large, and also among physicians, as well as other healthcare providers in brain health. And, brain health, we should address brain health over the lifespan, and not just start thinking about it in late life. And I do believe that psychiatry, by training, I'm actually a psychiatrist originally. Then I did geriatric psychiatry, and then I branched into memory disorders, focusing on Alzheimer's disease and related dementias. And brain health absolutely matters. It matters, in the youngest generation, so children, even adolescents, in terms of providing them with the right opportunities for education, socialization, and engagement. Young adults are often overlooked, but there are a number of options to intervene. And then, of course, middle adulthood and late adulthood. It is never too late to start thinking about brain health. And you mentioned specifically psychiatry. Psychiatrists focus actually on brain health. I think that dealing with anxiety, dealing with depression, dealing with addictions are extremely important. Dealing with trauma and helping people find ways to navigate through that are important for overall brain health. And sometimes I think that community psychiatrists overlook that role that they play every day. Now, as I said before, I think that the general population is very eager to learn more about how can they protect their brain, how can they, modify their risks. And I would believe that community psychiatrists are very interested in that. Do I know if they always feel they have all the tools to do that they have the knowledge base? or that they have the time within their practice. I do think that these areas are a challenge, but I also think that they are areas that you can improve upon. And, with education, there are fantastic educational programs provided by, for example, continuing medical education companies about brain health in multiple different specialties. I think that you can do this efficiently and in a time relevant manner. You can be time efficient is what I meant to say. And I think that you have an audience in the patients that see mental health professionals, and that there are interventions specifically in that group that will be very meaningful, looking at the total lifespan. So a long answer, but I think it was also a question that had multiple components to it.
Definitely agree. Speaking of tools, when someone comes into their community psychiatrist, maybe they don't immediately mention problems they're having with their memory, little glitches, things that they've been trying to write off as, oh, I'm just getting older. What kind of cognitive testing? We're already past the real basic testing that probably may have gotten the person to the next level of specialty. So, what kind of cognitive assessments do psychiatrists depend on in fairly routine visits, not necessarily something that's totally focused on the issue of cognitive impairment, brain health, and memory?
Yeah. Cognitive change or the sense of cognitive change are common complaints in, mental health conditions. Let me name a few possibilities. So in patients with schizophrenia, cognitive impairment is common. In patients with depression, the sense that your cognition is not as crisp as it used to be is very common. Same goes for anxiety disorders. And then, like I said, acute stress disorder, PTSD, let alone addictions. These are all areas where cognitive change or the sense that your cognition isn't as crisp is common and frequently brought up. So I think it starts with just a careful history and looking at both the cognitive symptoms, what are their what's the type, where is it emerging? Is it affecting people's ability to, perform on a day-to-day basis? Are they still functionally independent? So a thorough history matters. To look overall at the medical history as well as the medications that someone is on, and to do a decent mental status examination. And we're certainly used to doing that in psychiatry. For tests, it depends. I still think that straightforward, simple tests like the mini-mental state exam or even the mini-cog have their role. But we can expand on that, for example, with the Montreal Cognitive Assessment Scale, which is more sensitive to subtle changes. We may also, in many of these situations, have to reach out to our colleagues in neuropsychology. If we identify a problem and we really want to get a better hold of that, better understanding, is this normal? Is this part of the disease? And is it likely to improve if we are successful in decreasing the intensity of symptomatology? Or is this another condition that is traveling with, for example, midlife depression that is thoroughly addressed? or, various types of addiction that might have had their impact over the lifetime. So I do think that looking at risk factors for cognitive impairment is important, because many of the risk factors for cognitive impairment also increase your risk for either having a mental health disorder that is more treatment resistant, or may actually increase your risk of developing a mental health issue, such as depression. Let me list a few of the things that we know are a major lifetime risk for developing a memory disease late in life. And let's look at how many of those are, relevant to psychiatry. For example, low level of education. Well, a lot of people don't get a lot of opportunity for education. They might not have had the chance to stay in school for a long time, their home situation. But it isn't just how long you are in school, but how you look at that education through your lifetime. You can have low schooling, but you can continue to educate yourself, and there are multiple opportunities for that. Hearing loss is another thing that is a major concern for cognitive changes late in life. And that can start early. Some of the people that take the most risk with their hearing are actually relatively young people. That group is also at risk for traumatic brain injury, and protecting your brain, either, in contact sports or later in life from falls, is important. As you hit your adulthood or young adulthood, you start to see more hypertension, you start to see more diabetes, be that insulin-dependent diabetes or type 2 diabetes. You start to see increasing obesity. You have to deal with smoking, and you have to deal with addiction to alcohol and various drugs. And those are all risk factors as well. Depression that is poorly managed is a risk factor. So is social isolation. In fact, social isolation is a major problem. It has a tremendous increase in the risk of developing dementia late in life. But not only that, it can basically exacerbate or contribute to depression. Loneliness is really an epidemic. So physical inactivity. We know that if you're physically active, it's good for your brain, but it's also good for your mental health. Things that we often overlook are things like, pollution and the environment that you live in. So diet, exercise, dealing with cardiovascular risk factors, improving your sensory abilities, both vision and hearing, addressing cardiovascular risk factor, including obesity, hypertension, high cholesterol, diabetes, and physical inactivity. These are all things that matter. And these are relevant to mental health professionals and psychiatry. We actually are very good at kind of motivating people to make changes in their day-to-day lives and their choices. I think that will not only contribute to general brain health, but also to emotional health as well.
Well put. I really liked what you said earlier about needing to look at brain health earlier in life, ideally, and to maintain our brains and to be aware of these factors earlier than when we start developing problems. It reminds me of a friend of mine who had a car that gave out on him, and he had never checked the oil or changed the oil. He had no idea that that was necessary.
Yeah.
But fortunately, even if you do your personal vehicle that way yourself, there are a lot of repairs that can be done afterwards. We can change our lifestyle. We can improve our diet. We can start exercising, even if we never have done it before. And we can rid of bad habits and change them for better habits, which all are very important in improving our brain health. But at what point do people start noticing, do you think, start noticing that they're having changes? And how do people and how do doctors differentiate between something that's fairly minor and something that could be a sign of impending dementia?
Yeah. There are a lot of things in life that can temporarily impact your cognitive efficiency. You mentioned a few. For example, pregnancy and early motherhood, the common complaints. Oh my God, I lost my memory. I lost my mind. I was so distractible. I was so forgetful. You see that often for women also around the time of menopause. This can be part of stress. This can be part of various medical conditions that we deal with, or even medications. It's important to now and then look at your medications, and let alone, for people that have very stressful medical issues like cancer, where chemotherapy can impact your brain function. We often identify chemo brain as kind of a lingering problem after the acute cancer has maybe been suppressed. So how do I look at this? There are changes that happen to all of us as we get older. That is just a simple fact. We can't come up with things as easily. We may store the information, but it takes us longer to look for it. So retrieval problems, and often reminders and hints and writing things down can help with that. We can't multitask as well. So if you are, in midlife or later, don't try to do what you were doing in your late teens or 20s. Dealing with 4 or 5 things at a time and being able to juggle all of those balls in an efficient manner. That doesn't play to your strengths later in life. So kind of deal with 1 or 2 things at a time, bring them to completion, and then move on to the next thing. What are some of the things that are normal? What are some of the things that are abnormal? Retrieval issues are part of normal aging, but an absolute forgetting of recent conversation, recent events, or new information given to you, and where hints or suggestions don't even help, that is very concerning to me. If the problems that you're experiencing over time, over 6 months, over a year, become more frequent and more intense, if you start to go beyond just short-term memory difficulties or retrieval difficulties, and now you also start to see impact on your logic, your reasoning, your decision-making, what we refer to as executive function, you start to see an impact on your language function, so that now there are significant difficulties in finding the right words, and you are having trouble expressing yourself. Not just, I can't remember the name of that actor or that movie, but you can kind of describe what they look like or what the movie was about. But now that you're using imprecise language, like, that thingamajigger, that
guy.
that guy, and it just becomes harder and harder for people to to fully understand what you're saying. And the next, another aspect of cognition that you keep an eye on is visuospatial function. And that can be identifying faces that you're familiar with, or identifying landmarks, or navigation. If you find that you struggle more and more with finding your way around in an area that you should be familiar with, or you are with friends or family and you say, "Oh, I don't think I've ever been here before." But you have, and maybe more than once and more than twice. And so, it's the frequency, it's the intensity, it's the progression, and it's the characteristics of your cognitive changes that separate what is, an annoying part of getting older, and I'm there, versus this is a very concerning signal of something more serious. If you
Sort of
can.
like the difference between forgetting to put the ice cream away and putting it away in the cabinet instead of the freezer.
Exactly. You put that very well, Robin. And, that is very much true. If it begins to get a little kind of outsized, or it begins to influence your ability to maintain your independence, then it's time to look for help. It's time to look for help, I want to say. And you then need to see someone that has an understanding of these conditions and can help you really tease apart these kind of more troublesome experiences. Are they kind of within the range of normal, even if they are kind of somewhat intense? Or is this the first inkling of a brewing problem, maybe a neurodegenerative disorder like Alzheimer's disease?
Now, you mentioned earlier the fact that we're becoming more socially isolated as we age very often. When your partner dies, for example, all the kids have moved away from the area, your relatives are dying off, all these things. It is that much harder for a person who is alone to recognize their own difficulties than having somebody say, "Hey, you put the ice cream in the cabinet. Are you all right?"
Yeah, there's definitely a security in a social network. So it goes beyond being just good for your brain, but also if you're isolated, you escape attention, and you don't get attention until maybe things are in pretty dire straits. And previously I called that an endemic. There's an endemic of loneliness in late life. And in some ways, our society, here in America, is a little more vulnerable to that because people are much more mobile. In Europe, for example, and many other communities, people kind of stay within the community where they're born. And there may be both a formal family network and an informal network, and a greater sense of community to pick up the pieces if you see that someone is really struggling. Here, like you said before, the kids may live on a different coast. They're busy. They've got a lot going on, and if particularly if you become more isolated or less prone to reach out, things like a significant cognitive or functional deficit is easily overlooked. And like you said, friends and may move away, they die, and you kind of are left struggling on your own, and not always figuring out, what can I do? How can I turn this process around? Where do I go for enhanced socialization? Where do I go to make connections with and maybe make new friends? when my friends have moved away or passed on. It's a challenge for our society. No doubt in my mind about that.
You mentioned children, especially children who have moved away. Having your kids close by, obviously, they keep more of an eye on mom or dad and make sure that things are going fairly well, hopefully. But if a child has moved away, are there things that they can do from a distance to make sure that their parent is coping well and getting the care that they need?
They certainly can. There are multiple community resources. There are, for example, geriatric case managers. There may be, community organizations that go and provide support and structure, go to home evaluations to see if the situation can be improved in terms of mobility, in terms of safety. There are community programs that can provide opportunities for engagement and socialization and stimulation, brain stimulation. So there are some communities that are very rich in terms of this. Others, like maybe rural communities or inner city, where it is a little harder to access. But most communities have something. Knowing where to look and how to engage those resources can be a challenge. But for example, that's a time where maybe looking at a community or reaching out to a community organization like the Alzheimer's Association might be one step to learn basically what's available in that area specifically. The Office of the Aging might be another opportunity to kind of tap into resources in the local community where your loved one lives.
Well, Anton, this has been a fascinating discussion. Thank you for giving us your insights and for sharing so many helpful points about what people can do to try to improve and maintain their brain health throughout their life.
Robin, thanks for having me again. I really appreciate it.
Thank you very much, Anton and Robin. And thanks to you, the listeners, for joining us. Please look for 4 other companion podcast episodes discussing cognitive conversations in other clinical settings. As a reminder, to visit our full Brain Health Resource Hub, please click on the link in the show notes. As always, thanks for listening.